this is actually one of the most common questions we get when I'm seeing patients in clinic or getting questions or referrals from parents from either outside our hospital or at our hospital, which is essentially what's the role of molecular testing or genomics or sequencing of their child's tumor in terms of taking care of them. And it's really a tough question actually, because we're in a period where over the last 5 or 10 years, we've learned an incredible amount about the biology and the genetics of pediatric brain tumors. So many of the errors in DNA that cause abnormal signaling and abnormal growth of cells that result in the tumors. But we're in the phase now where we're trying to figure out how to take that information that we've learned about the molecular diagnosis of brain tumors and really bring them into the clinic to make them useful for patients. So at first they told us a lot about the biology of pediatric brain tumors and how they're similar or different to one another and the different explanations for why they grow and why they occur like they do. And so the focus of my research and a lot of others has been trying to take this to the next step of figuring out, well, if we can learn about what the genomics or what the mutations or what the errors in the DNA of the tumor are, how do we actually make those useful? And how do we use them to improve our diagnosis for patients, to give a more precise, accurate diagnosis of exactly what type of brain tumor they have? How we use it to provide prognostic information. So even within a single type of brain tumor, there might be molecular testing that can tell us if their child's likely to have a little bit better or worse prognosis, or that they might be at risk for certain toxicities with treatment, and all those kind of prognostic and informational bits. But then obviously the most exciting part is trying to figure out how we can use this to select treatments for our patients based upon the individual kind of mutations or genomics or whatever you'd like to call it for their child's tumor. So historically, the way a brain tumor was diagnosed was essentially based upon the symptoms and of the child and where the tumor is located. And then there'd be a surgery, the neurosurgeons take out the tumor, the pathologists look at it under the microscope and say, well, this looks like a medulloblastoma, or this looks like a glioblastoma, or whatever tumor type it might be, which in many cases is the vast majority of what needs to be done to make the diagnosis. But what we've learned is that there's a lot of ways in which having additional information can help refine those diagnoses and make them more useful for the oncologist and for the families. And so that's really the role of molecular diagnostics or molecular testing. There's some tumor types where it's already part of standard testing, that almost any hospital that's taking care of kids with brain tumors would do some certain molecular tests. That's historically been done using immunohistochemistry or antibodies. So basically looking at the under the microscope the tumor and then using a particular antibody that binds a particular protein to see what type of tumor they think it is, what type of cells they think it came from. And so that's part of standard testing. But now what we've done more and more of is looking for either individual genes or mutations or errors that might tell us what type of tumor it is or what the prognosis is or what drugs might be useful.